Thank you for giving us this time to be with you, to chat about your life and about what's important and meaningful to you. You have been a physical therapist for over half of the last century, and now almost 20 years in this century. And you have witnessed and indeed been a driving force for change in our profession. So let's start by asking you about your personal history.
Everything from the first grade through graduate school, everything I have loved about being alive is to be able to go to school in this wonderful country.
Yeah. Over the years, you have said the watchwords for me have been these: passion, persistence, and patience.
That's true.
What advice would you give us to how to translate those words into action? How does passion make a difference in the practice of physical therapy?
Well, I think if you don't love what you're doing, you're not going to do very well for whomever you're are in contact with. So I think passion, you have to really like what you do, love what you do, and act like it for other people to see it, the evidence.
They pick it up.
Yes.
They pick it up if you're indifferent or you're bored. What about persistence?
I think persistence means that you're constantly looking for how to do better what you do, and to make sure that you don't just give up. But the thing about it is that if you don't love what you do, you better get out and look for something that you can love to do. That's what I think.
You persisted over the years.
Yes, persistence.
Yeah, you persisted by starting the first entry-level master's program.
Yes.
And then in 1985, when you gave your Mary McMillan speech, you called for education at the post-baccalaureate level, preferably the doctoral level, and you felt that you were just quoting Catherine Worthingham because that's what Catherine Worthingham thought.
Yes.
Yeah. And you persisted over the years. But you got a lot of criticism from that Macmillan. It doesn't seem to have affected you.
No, it didn't. It just made me think more about what the future could look like if we were willing to accept the adventure.
It must be thrilling for you to now see that all programs now educate at the clinical doctoral.
Oh, it's wonderful. I think it's one of the boldest steps we've taken, but it certainly was a wise one.
What did you see that we needed to be able to do that we couldn't do as baccalaureate graduates? Why did we need graduate education?
It was a matter of respect, for one thing. And so by going to the doctoral level, we became, I think, more respected. And besides that, it put us in a category to be careful that what we were doing was the right thing for patients and also for us as a profession. I think that we've gotten bolder about issues related to restraints. I'm talking about law now. It's where we had to get a prescription before we could treat a patient. And that always rankled me because I had some experience in the Army where we were prepared to go to the battlefield. Well, we wouldn't have had a prescription for that, among other things. Fortunately, we haven't had a war that's called us since I stopped treating patients.
Well, and you were in the World War II.
Yes.
And then you were in the Korean conflict.
Correct.
Right. So were you treating soldiers at the time?
Yes. Yes, all of us did, from the top down, no matter what. And so it was a thrilling time because we were so useful.
Yes, and you had a certain amount of autonomy that then when you went back out into the community service, you didn't have.
That's true.
Yeah, and it called for...
But we worked hard all over the country to erase that barrier of not being able to treat without having a prescription which we ignored most of the time because we always needed to look at the person.
Yeah.
So we had what, I don't know what to call it, but we were evaluators and diagnosticians. And so that was a happy thing for patients and also helpful to our profession. It showed that we had the background to make strides toward helping people with whatever they needed to have.
Without the physicians telling us what to do.
Exactly. And most of us didn't anyway.
Well, and we got into some hot water sometimes with some physicians.
We did.
Yeah.
But I never did. And I don't know why that is, but I think I didn't ask for permission.
Rather apologize later than ask for permission. Yeah.
I don't know, but I have had a very happy life in physical therapy. And part of it is having the will to do when I needed.
It was part of the Physical Therapy Learning Institute. Now, you and Linda Woodruff in 1991 decided that you needed to have this special think tank group. And you got together in Dahlonega at the North Georgia College, and you said, we're going to create this think tank, and we're going to call it the Peach Blossom Learning Institute. Can you tell us about that story? About what were you trying to do? Why was it important to you to do this?
Well, I did a good bit of consultation, for educational programs. And it seemed to me that the people who didn't participate in those, for one reason or another, were left out, maybe by design. They just didn't want to be bothered. But it was an opportunity for them to learn how to be better faculty members and how to work together as a group to make their programs desirable. And of course, to educate people who were physical therapists of quality. And so that for me was one of the successes of that group, right. that we came out with some suggestions for how to create as well as how to innovate.
Yeah. Someone once said, when Geneva Johnson says that when people say, oh, that just can't be done, that just can't be done. And you said, well, you just never settle for that. You just say, what do you need to do it? What do you need to get it done? And that was the foundation of the beginning of the Physical Therapy Learning Institute, because it was a think tank where you brought in different people with different skills and different experiences and said, let's put our heads together and figure out how we can, without the bureaucracy of organizations to tie us down, how can we stimulate change?
So, there are all those heartwarming things to think about, what it is that we have as a group to give. And the sense of touch absolutely is the most important one. But, it's those things that really keep you interested in helping. And touch to us has always been extremely important. And how you touch and how that feels to you as well as to the patient. It's just remarkable. So that for me has been a very important part of the way I practiced.
Are you concerned that physical therapy education in some ways is getting away from the importance?
I think we don't emphasize it anywhere. I've been going back and looking at some stuff just recently, and as I'm doing some writing, thinking about what is it that we need to be looking at and wanting to include in our curriculum, anybody's curriculum, so that we get across the importance of touch and how healing that is. But you just don't go and grab somebody. You go gently, and it then becomes a part of the way the person reacts to touch. So, and I think one of the best things that we have done is to retain the touch.
The manual therapy part of physical therapy.
Yes.
Yeah.
Because there really is nothing like touch. I mean, you transmit a message by touching.
the Physical Therapy Learning Institute is your creation with Linda. And you've often said that you want to give us a charge. What would that charge be that you want to charge the members of the Physical Therapy Learning Institute?
Well, of course, in those days, I was talking about not having to have a prescription or a referral from anybody, that somebody else could take somebody else off the street and treat.
So you wanted one of the first things for the Physical Therapy Learning Institute to work on would be development of direct access. And so we did. We worked a lot politically and educationally to get programs ready to, especially with PT diagnosis, so that students could learn how to correctly diagnose indirect access. But what would it be now, today? We have direct access.
Yes.
What's on your mind for us today?
Well, I think I would like to have you get together and kind of hammer it out yourselves and say, what is it that's most important to me, to me, to me, to me? And let's look at how we would
prioritize.
One of the things we're doing now that I think is wonderful is this, I don't even know what it's called, for the teachers.
Oh yes, the development of new faculty and then mid-career faculty at the Education Learning Conference, the ELC.
We had that lady from England who came twice, at least twice. I don't know, could have been more.
Well, that's the Geneva R. Johnson Forum.
It is.
It is. It's named for you. It's named for you.
Are you ready for me again?
Innovations in physical therapy education. You're the innovator.
Yeah, I'm working on that, you know.
On being an innovator?
Well, to be a whole lot different than we are now. I just spend time because I don't have anything else to do, thinking about what is it we need, in my view, what is it would we need to make physical therapy education different, and what things would we want to emphasize? I'm not at all sure that everybody looks at this as important, and that's the administration. And so, you know, I'd like to put a little shove on there saying.
What brings you the most pleasure when you think back about your life as a physical therapist?
Most pleasure? As a physical therapist? Oh, I think the time I spent in the Army. Because we had a lot of freedom that people out in the territories didn't. And so I would say I'd put that first, that the experience in the Army was, for me, formative. And so I treasure that. I've had a wonderful life. I'd like to say that because it's true. I started out at 5, climbing the steps of the school and marching into the first grade room, and nobody said anything to me.
And you've been learning ever since.
Yes. So I stayed, and I had a good time.
And your whole life has kind of spun off from that, just deciding what you wanted and going for it.
Yes. Asking the Lord to help me.
Thank you for this. Thank you for everything that you've done in your leadership in physical therapy, and especially your inspiration to so many people who just
Carol,
adore you.
The blessing for me has been beyond expression.